All right. Welcome, everyone. Would love to welcome everybody here today for NASHB's webinar on state strategies for state-local collaboration and opioid settlement spending. As most folks know, states are in the process of implementing administrative structures to disperse an estimated $50 billion in funding. They'll be awarded to states and localities from opioid-related lawsuits over the next several decades. Of course, each state is a little bit different in terms of how the funding is split across state and local entities and how those administrative structures or processes are being set up. But whether those decisions are occurring at the state or local level, we know that it's essential that we're working together to understand how to address the needs of each community and make sure that we're working together to maximize the impact of these funds while making substantive progress and investments in our collective prevention, treatment, and recovery infrastructure. Normally here at NASHB, we often hear the state perspective, but today we've invited both state and local officials from Nevada and Wisconsin to briefly share some of their own experiences about how they're collaborating within their own state. So we're excited for a great conversation. And I'll just briefly go over some logistics in our agenda before kicking off for our speakers. So just in terms of logistics, this webinar is being recorded and will be posted in the NASHB website. Audience members will be automatically muted, but we invite you to ask questions at any time using the chat or Q&A, and we'll get to as many questions as we can during the Q&A portion. So the Q&A function goes to panelists only, and the chat goes everywhere, just as an FYI. So we'll have two presentations, four actually from different speakers in Nevada and Wisconsin, and then we'll open up for Q&A and a discussion. Next slide. Just went over the agenda. And so next I'll talk a little bit about NASHB's efforts to address the opioid crisis. For those not familiar with NASHB, we're a bipartisan nonprofit dedicated to supporting state leaders from both the executive and legislative branch on some of our most pressing health policy issues that impact the health of our communities. To that end, NASHB is working to help state leaders across policy landscapes enact and expand policies that can enhance access and outcomes for substance use disorder and opioid use disorder. Can we go to the next slide? Our opioid center contains a really wide variety of resources to support state leaders in addressing the opioid and substance use crisis through the expansion of effective prevention, treatment, and recovery resources, really with a particular focus on settlement planning resources for states. To date, we've published a number of case studies for how states have approached opioid settlement administration, as well as a webinar spotlighting Maine's efforts. Our state opioid settlement trackers live, which provides sort of a one-stop shop overview of funding allocated to each state through the national settlement, as well as state-by-state tracking on key components of settlement planning and spending, including legislation, agreements, executive orders, agencies or entities charged with dispersing state funding, state and political allocation splits, and the role of advisory committees in guiding spending. So in conjunction, we also released issue brief, really trying to demystify what can be an opaque process around opioid settlement spending and highlighting some key components and considerations for states. And we'll be publishing a blog after this webinar, really highlighting some of those strategies around state-local collaborations. So lastly, I'd be remiss if I didn't mention that these efforts are possible through the ongoing support of the FOR Foundation. And also wanted to thank Sammy Karen and the National Association of County Officials for their collaboration on this important topic, and would encourage everyone to check out their resources as well. So with that, I'd love to jump into it. I'm excited to introduce some fantastic speakers today. We have some really great examples to discuss from Nevada and Wisconsin. I'm happy to introduce Don Yohey, who is the clinical program planner at the Nevada Department of Health and Human Services. Also from Nevada, Mark Krueger, who's joining us from the Nevada Attorney General's office. In Wisconsin, we have Paul Krupski, who's the Director of Opioid Initiatives at the Wisconsin Department of Health Services, and John Doemel, who's the County Executive from Winnebago County in Wisconsin. Again, just in terms of framing the conversations, we know every state's a little different, but the need for coordination, information sharing, and really working together is imperative if we're going to direct opioid settlement spending to where it's needed most. So love to talk today a little bit about how you've set up processes to share information, to work together and share best practices, and ensure that you're capturing the impact and reach of these investments and any sort of lessons learned along the way. So we'll hear about 5 minutes from each speaker and then jump into Q&A. Please do feel free to add questions to the chat. So with that, I would love to turn it over to Dawn to get us started.
Thank you. Again, Dawn Yohey, I'm a clinical program planner for the Department of Health and Human Services. Today, I think it's important that we go through, and you can go to the next slide, a little bit of the history and our legislation, our needs assessment and state plan, and then we're going to get into the One Nevada Agreement, which is really a lot more of our state and local collaboration and coordination. Next slide. This slide is to help us keep in mind that as we go through this information today, Nevada adopted the Johns Hopkins principles in the development of this legislation. So it's spend money to save lives, use evidence to guide spending, invest in youth prevention, focus on racial equity, and then develop a fair and transparent process for deciding when to spend funding and how to spend funding. So within the legislation, we did develop an advisory committee for Resilient Nevada. Next slide. This committee we call the ACORN, the ACRN. It's comprised of members who range from subject matter experts in the field to consumers and family members who have been affected by the opioid epidemic. Their primary goal was to identify and prioritize recommendations based on our needs assessment, and in a report to the director, identify what they believe would be potential allocations for the fund. Next slide. This slide is about the creation of the fund itself. This is the Fund for Resilient Nevada. A state's portion of the recoveries is deposited into this fund after payment to the counties and the lead litigator costs and fees. Something to note about these recoveries is that it is supposed to be specifically used for the abatement of the opioid epidemic. Next slide. Our statewide needs assessment. So a little bit about our needs assessment, which was also within our statutes. It was created using the damages report in the opioid litigation. We also used community-based participatory research because we needed to get the local voices. We needed to understand what was happening within our communities. We did outreach to other governmental agencies who interact with groups impacted, such as public safety, corrections, courts, juvenile justice agencies, and so many more. And then we also got input and advisement, again, from our advisory committee and other sources, which included public meetings. So public got to come to the meetings and have comments on the needs assessment, on the recommendations, what they believe we needed to fund. We also got regional, local, and tribal agency comments as well. So next slide, from that needs assessment, we're able to develop a state plan. As we were creating the statewide plan, we noticed that it would be better to have the needs assessment and the statewide plan in one comprehensive document. Because there was just so much information and it was a disservice to kind of split them up. And so we ended up just adding a couple of sections to create the statewide plan. Throughout the document, you would be able to see there's sections specifically that comprise the needs assessment, and then it moves on to present the opioid impact, currently available systems, and then also corresponding gaps. The gaps that were identified informed the recommendation section. And then once we got into the statewide plan sections, you would notice goals, strategies, objectives, and activities that were developed specifically from the recommendations and the priorities the stakeholder feedback. So these are the priorities and the recommendations that potentially are going to be funded through our fund. One of the final sections that you see offers information about our next steps and further detailing activities, what other funds are in the state. We want to make sure we're not supplanting anything, and also a preliminary allocation of the fund itself. But these proposals are not the only funds allocated, because like I said before, there are other opioid dollars throughout the state. The next slide we wanted to talk about is our One Nevada agreement. I'm going to hand this portion over to Mark to discuss, because he was a huge hand in developing this. So Mark.
Thank you, Dawn. Hi, everyone. So I'm Mark Krueger, Chief Deputy Attorney General for the state of Nevada, Office of the Attorney General. We were faced with a dilemma when we first started litigating, in that we are the 7th largest geographic state, but we have a very small number of counties. We're only 17 counties. Of those counties, the state and certain litigating cities, most of them ended up hiring and retaining the same outside counsel. However, there were a few that didn't. This created a difficult scenario in which we would have to be able to try to drive settlements together. And in negotiating this agreement, we realized that there were also counties who didn't litigate at all. And so in order for us to use the money, we had to figure out a way to allocate it, which would allow us to be able to bring the money in and give it fairly and equitably to all of the litigating state, counties, and cities within the state. So we developed this One Nevada agreement on allocation of opioid recoveries. It also was intended at the time to cover any kind of bankruptcy recoveries, including Purdue and Mallinckrodt and the other ones that have now gone into bankruptcy. Basically, what it did was it realized is that there is a idea or a thought or standard practice in the industry that everybody, the lead litigators, should not have to be the only one bearing the cost. So as the lead litigator, the state of Nevada shouldn't need to be hit with all the costs in the entire case. And we therefore then remove the costs off the front. Just as a side note, the issue of whether or not there might be some damages based on Medicaid, and those recoveries may or may not need to be paid back to CMS for the FMAP share or the federal share. So those would all be deducted prior to doing that. And then it just literally allocates all the money against all of the counties, whether they're litigating or not, and all of the litigating cities and districts. And we've found that this agreement has been a wonderful tool for enabling us to move forward with our litigation and get settlements. And then the money goes out to everyone. So what does that mean? What happens when the money comes in from this source? Well, it then goes statutorily for the state into the fund that Dawn talked about, and then it gets definitely allocated towards use for abating and addressing the opioids epidemic in Nevada. So I can turn it back over to Dawn. I guess we'll go to the next slide.
Yeah, I think you have one more slide. This is,
yeah. Yes, sorry about that. So this kind of gives you an idea of how, just what I started talking about, this gives you an idea of how the funding actually works. If the settlement funding comes in, the costs are removed, any other fees or actually any other costs are removed. The remainder then goes through the One Nevada agreement, where it distributes out, as I said, fairly and equitably to all of the parties and participants, signatories to the agreement. And it's very, very important to note that not only do the settlement agreements require the use of this money to abate opioids epidemic, but the agreement itself also requires these counties. We also put in a accountability reporting mechanism so that on an annual basis they report how they were using the funds to the state, and then the state has the ability to then double check and make sure that it's consistent with the agreements or the bankruptcy orders. Then the state's portion then goes into the Fund for Resilient Nevada, as we discussed, and then it goes through the process of being determined what priorities are going to be funded first. And that's really under the Department of Health and Human Services, bailiwick, and exactly what Dawn started talking about, and how they utilize the ACORN committee to help give guidance in developing the state plan, which then gets amended every 4 years to make sure that the needs are changing as we abate the epidemic throughout the state. And also, I just want to point out that it's important to note that as a geographically large state, we have a lot of different needs in the different areas of the state. And so that was very much a consideration as we were going through it. And also we considered very much how the locals would use it, but more importantly, because opioids doesn't care about county lines or federal and state lines, how we could get the local governments and the tribal governments to work together so that we could have uniform and programs and services that will actually cross over and treat everybody that is suffering from this crisis. Next slide, please. Go ahead, Dawn.
Yeah, thank you, Mark. So it was identified that we needed a collaboration with a lot of our local governments. And so we actually collaborated with our NACO. It's our Nevada Association of Counties. We assisted in developing a needs assessment template that was distributed to all of the signatories and the counties and their leads. And we asked for them, we gave it to them. It's not necessarily a requirement unless they were going to be going for the state's portion of these funds. And so we had said, hey, if this is something that in the future you potentially would like to use the state's portion of our funds, as well as your own county funds, here's the requirement. So they are also required to create a needs assessment and a state plan the same way we did. So we were able to assist them with developing that template. And then
Dawn, if you don't mind me jumping in real quick here. One of the things too we noticed is that in Nevada we have suburban areas, we've got rural areas, and we've got frontier areas. And we know that some of the counties are very much frontier counties, and they would not have the ability to stand up programs and services on their own. So we encouraged a lot of these counties to collaborate and work together and use the template that was provided by the state from the Department of Health and Human Services to develop a multi-county approach to handling their needs in their region, and that has been very successful as well.
Thank you. And then the next slide, kind of piggybacking off of what Mark had said, we did actually add some of this technical assistance piece into the legislation as well. So within the statute, the state is able to assist with any needs assessments or technical assistance for any needs assessments that counties or tribes have requested. We have also worked with our Department of Health and Human Services Office of Analytics to be able to get data requests to the counties as well. So Mark, anything to add on this one?
No, that's all.
Okay. So yeah, thank you guys so much. Are there any questions? Or I guess we'll do questions later.
Yeah, we have a couple questions in the chat if we want to get to those. One specific question is around the criteria that counties, cities, and districts are required to follow along lines of transparency, planning, and equity, and or are there specific priorities that are set across all counties and locales? I know that's a big question.
Well, I think we can break it up a little bit. Obviously, the transparency portion of it is required in the reporting so that we know what the funds are being used for. You got to keep in mind that the amount of funds that were allocated through the One Nevada agreement are the counties or cities or whoever the signatory is that receive that funds, and they're able to use it on what they've developed as their own needs. And as Dawn said earlier, they don't have to develop their own county needs assessment or plan. We encourage them to do so, But if they don't, they can develop their own internal way of spending the money. As long as it's spent in a manner that's consistent with the settlements, any bankruptcies, the funding source basically, and the One Nevada agreement, which provides a link back to the statutory authority, which goes and specifically cites to the state plan. So the state plan is a very comprehensive document that allows a number of different spending. And as I said, the spending can be in different areas of the state, can be look totally different on those programs and services. So we don't really, we try to encourage them to make sure that they use all of those evidence-based practices, and we make sure that they're using the money in a way that's consistent with the practices that we've provided in the state plan, which is actually consistent with the settlement agreement language too. So I think that answers the question. If I haven't thoroughly answered it, and Dawn may want to jump in, then I'll be happy to try to break it down a little bit more. If not, I'm going to go ahead to the next question, which are these funds matchable through Medicaid? And if so, what percentage of funds are flowing through Medicaid program? So Medicaid is an interesting animal because with the way the rule works essentially is that if you have settlements in a normal scenario that were based upon any kind of damages using Medicaid information and statistics, et cetera, then the state is required to repay back the FMAP share, which is the federal share of, which differs in every state, but which is the federal share of those funds. And so we took into account that, but it doesn't, there is no matching for the Medicaid dollars for the amounts that we get in. I hope that makes sense.
Yeah, and I might pause questions at this point, just so we get a chance.
Yeah, I keep generating more. So.
Yes, yeah, exactly. And I'm sure our friend from Wisconsin might also be interested in chiming in on some of those. So at this point, I will hope my dog stops barking and turn it over to Paul.
Thank you, Katie. Appreciate the opportunity to present, and good morning or good afternoon, depending on where you are in the country. Sam, if you want to go, you can actually go through 2 slides. Yeah, thanks. So here in Wisconsin, we also have legislation that was passed that dictated how incoming settlement funds would be divided and allocated. So in our state, Act 57 was passed in March of 2021 in advance of these settlements, any settlements being reached, obviously knowing that they were coming. And so what Act 57 details is that 30% of settlement funds come to the state and specifically to the Department of Health Services. The remaining 70% go to any other local government that was party to the litigation. In our state, we have 72 counties. 71 of those were part of the litigation, and I believe about an additional 11 or 12 municipalities as well. That 70% that goes to local governments, they have complete autonomy of those funds. The state does not have any role in determining how counties choose to use those funds. The state does not require any reporting on how those funds are spent. Similar to what the Assistant Attorney General just said from Nevada, obviously they have to spend those funds within the guidelines of the settlement agreements. But other than that, it is left to the local government, each local government individually, on what transparency would look like, on what any type of reporting would look like. It is just the 30% that comes to the state that we are required to report back to the legislature on spending. And obviously we're transparent with our spending of funds anyways. So we do have dedicated web pages that details how those are being spent, what's being spent on, and so on and so forth. Also part of Act 57 is that before we can spend any of those state funds on an annual basis, the Department of Health Services is required to submit a settlement planning or settlement fund spending plan to our Joint Committee of Finance at the legislature, and that's due April 1st of every single year. So we just did that for the first time in 2022. So it was an interesting experience. Everybody was kind of working through a brand new process. We submitted our plan on April 1st and had some back and forth with the legislature. Obviously, many of you are aware that the settlements this past year, even though they were reached in late February, we went through the majority of the year without knowing how much we were getting and when we were going to be getting those funds. So that had to do with some of the back and forth, but we did gain approval of a plan on September 8th of last year. In the end, our Joint Committee on Finance kept about 85% of what the Department of Health Services recommended, and then made some changes and additions to that, to the remaining of the plan. Next slide. So in advance of all this settlement funding coming, our department, just like I'm sure every other state, we have a ton of data that comes into our department or our repository for a lot of different types of data and data sets, and we do a ton of analysis on that. We do needs assessments and create a lot of other reports, and we use all that information to make data-driven decisions whenever funding comes into our department, not just on opioids, but anything, so that we are filling needs, we're filling gaps across our state, and that we're using the funds as best as possible. So we had already been preparing all of that, but we wanted to get some qualitative data as well that we thought was really important. And so at the beginning of 2022, we set out and did a dozen listening sessions across the state. And as you can see on this slide, really the purpose was just to hear from Wisconsinites, hear from providers, hear from individuals who have received services, families, friends, and caregivers who unfortunately have lost loved ones to the opioid epidemic, to hear how they would like to see these funds being spent and what they think the needs are across the state. So next slide, please. As I mentioned, we held 12, we have 5, we break our state out into 5 regions. So we did 2 in each region, and then we had 2 evening sessions for anybody to attend. And then we had a corresponding online survey that anybody could submit feedback on how they'd like to see settlement funds spent, if they weren't able to make the listening sessions, or they just weren't comfortable sharing information that way and would prefer to do it written. So next slide then just shows we were really pleased with the turnout that we experienced in our 12 listening sessions. Had just over 500 people attend, and then another 300 plus surveys that were submitted. So ended up hearing from about, say give or take 850 people in this that participated in the process, which we found really valuable. Next slide, please. So from there, we analyzed all of that data that we received, all the feedback and input we received from those listening sessions, just like we would do any other type of data that the department collects. We created a report, and in that report, there was a list of recommendations just off of the feedback that we got from the listening sessions that we created. And then we released that report publicly. We wanted to be transparent on what we heard and the feedback that we received. And then, as I mentioned, this was part of what we used as input for just our overall plan that we needed to submit to the legislature. Next slide. Next slide. So our plan for just to touch on this really quickly for 2022, our 30% came out to just about $31 million. We have begun awarding funding, and when I say begun, I mean just begun. We've awarded about $1 million to a little over $1 million at this point, but we do have another 8.5 million that is open for solicitations right now. That will be closing in the next couple of weeks, and we're working on about another $12 million of funding through some different applications that is going to be open in the next couple of weeks as well. So it's been a process, but we're working on it, and we're starting to get that money out the door. Next slide, Sam. So I guess a couple things to say here. I won't go through all this, but this is in general what our plan included for 2022. Wisconsin's comprehensive approach to addressing the opioid epidemic from the beginning has been to invest across the continuum of care. And so that was our, something that we remain committed to in our approach with these settlement funds. So you will see that here from prevention to recovery. But part of what was really important as well too, and what we wanted to do with our plan was to really make sure that our counties and other municipalities have this to use as guidance as they begin to determine how are they going to use their funds locally. So basically we wanted to, plant that flag in the ground and say, hey, this is what we're going to be investing in this year. Counties in the state of Wisconsin, counties are really our frontline provider when you talk about treating substance use disorders. So they're going to be eligible for a ton of this funding. So basically letting them know this is what we're investing in. This is where you'll have the opportunity to apply for funding for. Think about how you, what isn't being covered here, what gaps or needs exist locally that this won't address, and then consider using funding that way. Just really in an effort to make sure that we are leveraging all the funding that is coming into the state, to the maximum ability that we can. So, this, along with, like I mentioned, the report we published off our listening sessions, all the other data that we collect, that's all stuff that is really important that we want to make sure the counties have available to them as they make decisions. So on that note, the next slide then, Sam, and you can go on to the next one. Where we're at, the Wisconsin Counties Association is really our primary collaborator in this work. Again, because of how Wisconsin is set up and how services are provided, we have a very good relationship with the Wisconsin Counties Association. Very strong relationship. We work with them on everything in the health arena. Happy that they reached out to us and wanted to partner on this, wanted to get support from the department. And in August of last year, they began holding summits on how to best use these funds. They've held 2 already. There's a 3rd scheduled for tomorrow, actually, that I will be at and I'm looking forward to. So DHS has been a partner in all these summits, and we just continue to provide them updates on what we're doing, when to expect those funds to be coming through, what resources we have available to them, that we have staff that are available to provide them with technical assistance. The last summit talked a lot about encouraging counties to do a needs assessment. So talking about what that looks like and how DHS can support them. So it's that type of partnership that has really, formed in this space, and I expect to only strengthen as we move along and really find ways again to make sure that these funds are being used as best they can to address the opioid epidemic in Wisconsin. So I will stop there and pass it over to John, who can just talk a little more about what the counties are doing specifically at this point in time.
Thanks, Paul. I really appreciate that. John Doemel, I'm the Winnebago County Executive, also the chairman of the Task Force on Opioid Abatement Strategies in the state of Wisconsin through WCA. We've gotten together with our group. We've formed this task force that's comprised of many district attorneys, sheriff, public health, human services, other elected officials throughout the state, through multiple counties, so we can really look at the situation. Through that, one of the things that we notice is that all counties seem to be in the same, having the same issues, but very different challenges. One of the reasons that we encourage people to do their own needs assessment in their counties and kind of assist them and how to do that, how to best look at it. If you don't have a opioid or fatality opioid review board, how do you use your services, your register of deeds and the service you have in your county to get some of that data out to see what your issue is. We found that the situations are very different in multiple counties. It's different substances they're using, different types of ways they're using, whether they're using alone. Some counties are finding people that are using in public spaces, convenience stores or restaurant bathrooms or parking lots. Some people are very solitude alone in their housing units, and some people are using in pairs. So it's very different for each county to see how they're going to address the issue. The summits have been very helpful. Paul's correct. Our next one is tomorrow. We've kind of been moving that around the state a little bit to make it easier for people to go to get to. We are really leaning heavily on the regions. When we look at it as the task force, what are the programs and what are the resources we can bring that would either cover a full region or at least touch one of each of the 5 regions that we have in the state. These are the recommendations us as a task force are going to bring forward to counties to show them what resources are available. There's many different stages in this. There's prevention, the population that's using, population and treatment, and the recovery community in each of our counties. We're finding it's very helpful to connect our recovery communities throughout different counties so they can share their stories and successes and failures and kind of learn together as a team. And we need all 4 of those to come together while we're still considering public safety. One of the issues that we have, and many people have seen in the news, is officers having to be Narcan when they're touching substances with fentanyl. How do we protect them? There are true narc units out there that can scan and detect fentanyl in bags or pouches, but they're very pricey. I mean, they're $38,000 or more a piece. But if that's what's going to save officers' lives and law enforcement's lives, it's something we have to look into. So the issue is, even though this is a lot of money, and it's a lot of money, I'm not denying it's not, we could spend this and we could spend it quick. So you really we're focusing on getting all the shareholders together and having those discussions so that everybody understands the direction we're going. Not everybody's going to get everything. Here in Winnebago County, we are committing our opioid settlement dollars to a Connect program, which is more of diversions. So when people get in trouble with the law, we help them out with treatment. We help them out with GEDs and job trainings and mental health diagnostics, and we try to wrap the whole thing around, because that's the population we are finding are overdosing higher than normal. So that's really what we're focusing on. But that doesn't mean there's not other funds out there. And I think Dawn and Mark covered that really well, is that you have to look at the other sources that are coming in, and how do you blend those? How do you blend those sources together, if you can blend those? We are actually tomorrow in the summit covering how you should braid the funds instead of blending them, because it gets very tricky. A lot of things in substance use has to do with alcohol. Well, that doesn't apply to this. Like these monies can't be used to treat alcoholics or any issues with that. So how do you keep those separate so that you're following all the regulations of this? So there are a lot of questions for a lot of different departments in the counties. Your finance is going to have issues with this. If you're lucky enough to have health and human services together, you might have a little bit more collaboration than here. We have public health and human services. So they both, want to get a piece of that money. Same thing with the sheriff for the true narc units that I talked about before. So it's really getting everybody at the table to talk about the issues and how you come together as both a state and a region to deal with these. And as counties, how do you work together with your stakeholders to make sure that you're doing the best you can? And one of the things that Paul always likes to hear when us counties are working with the state is that we're data driven. Let the numbers drive you. Don't let your heart lead with this. So that's a big thing on this and that's why we're asking all these counties to do their own needs assessments in their own regions. If a couple of counties want to get together and do that together, we're fine with that, because we really want to see how different the issues are, the challenges are per county. You guys talked about having frontier regions in Nevada. I mean, that's got to be much different than what you're seeing in urban centers. So it's a challenge. There's no easy solution on this, but really just getting everybody collaborating the best way possible and listening to your experts and making some tough decisions on that, so that the use of this money comes in, it's not wasted, and we actually can affect the issue here, that we can actually save lives, and eventually we can lean into prevention. Right now, I think we're all in triage. Why we have wonderful events like this for people to get together and share ideas and figure out how we come out better on the other side.
Wonderful. Well, thank you so much for this incredibly rich information. I'm sure we have a lot more to dig into here. So I know people have been asking questions, and some of those have been answered live, but would invite folks to chime in with any questions they have, and want to look to one in the chat right now, which is what sort of evaluation is your county or other counties doing to look at the impacts of spending? And I think this is a really important question, and you've all touched to some extent on some of the reporting that's being done, but what information is being collected, and how are you thinking about providing that transparency about where the funding is going and its potential impact in terms of outcomes?
Well, I can jump in and start a little bit from Nevada's perspective. First, I want to highlight some of the things John said. Absolutely, we may have come to the place in a different route, but once we got to the place, everything John said about how the programs have to be established, and it's particularly right now, I think Nevada and Wisconsin share that we're in this triage mode. I'll take his words to try to save lives at this point. And that along with that is standing up treatment centers and programs and trying to address that. So then you're right. The next question, and the question's right. What do we do about making sure that we adjust? Because once we get programs and services standing up, we need to make sure they're effective. If they're not effective, then we're just spending money. So it's a moving target. And the way that Nevada has handled it is by the Department of Health and Human Services collecting that data and putting that data into a report to the legislature every session. This helps to also Department of Health and Human Services will use that data to adjust the state plan to say, okay, we need to move it here. We also encourage the counties to do the same thing, adjust their state plans or county plans rather, and make sure that they're addressing the needs that actually exist, because the needs change. And we even find that with the illicit fentanyl and other drugs that are coming in and impacting the treatment, the ability to do the treatment as well. I don't know if Dawn or John or Paul, you have anything else to add to that.
Yeah, I would like to address that, because I get that question asked a lot, and it's a really hard question to answer because prevention is probably really what we're focusing on. How do you measure prevention? We'll never be able to collect the data on how many people didn't overdose because of Narcan that we know about. Sometimes that's used in the private center. We have no idea to measure, what those overdose deaths would have been over the last 2 years if that wasn't a product that was available. So it's hard for me as a county executive to quantify that data that we won't know. We won't know how many lives it saves. On the other end of that, for our situation here in Winnebago County, we're really going to be looking at our recidivism rates. How many people that we go through treatment do we have to see back at treatment? How many of those people can get 2-3 years of recovery? That's really going to be our focus, and what I think we can actually measure that's qualitative and quantitative. But prevention is really what we're all looking at, and I don't know if Paul has an answer how you measure prevention. I'm all ears.
Well, I'll just add that we are developing required reporting metrics and an evaluation for each of those strategies that you saw on the one slide. For what we're investing in this particular year. So our staff is determining what are the best ways to evaluate those different strategies and programs. And then that'll be obviously individualized, and that'll be how we determine basically, is this a successful use of funds, something that we should consider continuing, or is it something that maybe we want to pivot and move in another direction, find a different way to impact that area of the continuum or whatnot. But we will, going back to transparency, all of this information will be available to the public on our opioid settlement web pages and websites on the DHS website as we continue to move forward with this funding throughout the years. So.
Great, thanks.
This is Dawn. Can I just jump in real quick? So one of our goals too is to really ensure our local programs have the capacity to be able to implement recommendations effectively and sustainably. What John was talking about earlier, yes, it's a lot of money, but it's a lot of money that's going to be here and then it's going to be gone. And so we need to really have a good plan in place for the longevity of these funds for programs to make sure they're running at capacity, or programs that are already funded, what he was talking about, braiding funding. So make sure everybody is running at capacity and then expand and enhance those programs that are working in order to get to the sustainability piece. And so I just wanted to kind of jump in and talk about, like, you know, that's one of our main goals as well.
Agreed.
Great. So I know that there was a question that was answered in the chat about allocations to tribal organizations, but wanted to talk a little bit more broadly about how you all are working with and partnering tribal leaders and tribal health organizations. I know there is a separate opioid settlement with a number of federally recognized tribes, but obviously the work that you are all doing might be beyond that. So would love to hear a little bit about how you are coordinating and collaborating with tribes in your state.
This is Dawn. Can I just jump in real quick? Something that we've identified is the need for kind of like some regional opioid coordinators who have a touch point not only nationally, but to our local levels as well. And one in particular will be sitting with our tribal consultation. And so that we always have that foot in the door, and then, you know, we understand what their needs are, because it's not just us coming down and being like, here's money, here's how you have to use it. It's, you know, do they have, again, the capacity to be able to use the funds in the manner that the litigation says they need to use the funds, or, you know, maybe it's just that conversation piece of like what needs to be changed in the needs assessment, or what needs to be changed in the state plan in regards to our tribal entities. And so we're just trying to partner with them and definitely give them a coordinator so that we always have a touch point.
Yeah, and here in Wisconsin, we have 11 federally recognized tribes. Within our department, we have an Office of Tribal Affairs. So we have a very, again, close working relationship with all the tribes. And we have our department has longstanding biannual, twice a year consultation with all the tribes. So we were able to use that process to really discuss with them thoughts on settlement funds coming in. But again, to go back to data, the most recent data we have available to us shows that our tribal communities or tribal population have the highest death rate of any population in our state related on opioid related deaths. And so even though, Katie, as you mentioned, that there's a separate settlement process for the tribes, we felt like it was our job and duty to be supporting the tribes as well through this funding. I think the question actually was something around how much was it allocated. I think with each state, it's obviously going to be different, right? But what we tried to do with all the different strategies that we're funding is that we didn't want to, obviously you don't want to overextend yourself, right? So we also tried to make sure that with all the different strategies, whatever amount we're allocating for that is enough to be impactful. Now, I realize that's a very broad general term of how do you define impact, but we're not going to fund something just to fund something. We want to make sure that there's enough behind it to where we think it'll make it. So we in this initial plan, again, because we got so much more upfront funding, we allocated $6 million for our tribal nations. And we were happy that the legislature supported that and left that in the final approved plan. And how we really wanted to work with them on this was we want it to be tribal driven. We didn't want to say, you know, here's the activities or the strategies that you can use these fundings for. Give us an application saying what you, we left it very broad and very vague and said basically throughout the continuum of care, where are the needs that exist on the reservation or in your communities? Tell us what those are, tell us how you'll address them. And again, just that left it very open, wanted to be very driven from the tribes. And that's one that's currently out on the street. So we haven't got those applications in yet. We don't know but we definitely wanted to make a significant investment to the tribes up front in this first year since we got the large upfront payment. You know, we stressed with them this might be a one-time thing, depending on, you know, how obviously future years payments level out and become much less than what we got this year. But you know, we do work directly with them through our Office of Tribal Affairs, which I mentioned, and then just the long-standing relationship that the department has with them, and so that's how we worked that process. But again, it's at least at this point we have stress with them. It's probably it's one-time funding at this point, but we're hoping that there can be more in the future. We just have to wait and see.
Great. And then I'm seeing a couple questions in the chat about how you all are thinking about overprescribing or pain management and its role in driving the opioid crisis in terms of your assessments and your spending plan. And you know, many of you have talked about the importance of prevention, and I know we're seeing some really alarming increases in the adolescent overdose rate, for instance, and John spoke really compellingly about some of those unique needs at a local level. So would love just to hear you all talk a little bit about how you are thinking about prevention, both in the assessments and the spending plans as you're developing and carrying out those priorities.
Yeah, I'll touch a little bit about the prescribing. Work with your pharmacies. I understand that pharmacies were one of the industries that was sued in this settlement case. But in Wisconsin, our Society of Pharmacists have actually come together with our task force to say, how can we help? What are the toolkits that we can offer? What are the things that we need to do as pharmacies to do a better job? So it really is just about having those conversations. And just because they're on the other side of the table, if you would, doesn't mean that you can't work with them in the future or figure out how can we do this together. I think they realized that they had a hand in this. And that they want to be willing solutions. Now, of course, trust but verify, right? I don't think everybody wants to say that the solution is another form of drug that we're going to prescribe to everybody else. So we have to be very careful of that. As far as, you know, the other kind of prevention and similar needs, that's the issue. I mean, that's why we're doing these needs assessments and smaller issues, because there's so many different. It's like homelessness. There's not one type of housing that solves homelessness. There's all different types of populations that are each unique in and of themselves. For instance, we just had a presentation in Wisconsin here from a Meta House, which is a treatment facility that focuses on young or expecting mothers. They can go 8 months pregnant in this treatment facility and continue to have their child with them. They accept mothers with children under 4 to go into treatment with them. They have childcare and all kinds of other services. What are those niche populations that aren't going to be covered by a general treatment facility? And those are the things I think you have to look in your state and how you connect those dots to each other.
You know, if I could just jump in real fast too, and in addition to everything John said, the national settlement with the distributors have all required the distributors to increase the amount of suspicious orders reporting that they're finding, and we're getting that. It's being funneled to our pharmacy board in Nevada, who is working with the Nevada Division of Investigations to to review those reports, as well as other reports that may come in. Also, our PMP prescription monitoring program has been expanded, and many of the pharmacists now have access to be able to check the PMP themselves, and there's cross-referencing on different prescribing habits.
Yeah, I'll just echo what Mark said. You know, there's been longstanding efforts in our state to educate and promote awareness with hospitals and health systems, as well as pharmacies. We partner with all of them, the Pharmacy Society of Wisconsin. The PDMP is obviously a huge tool, and we're always looking at if there are ways to improve that to help prescribers. But yeah, we didn't have any, at least initially, we don't have any settlement funding going to address specifically provider education or awareness. Part of that, again, just because of the work that the longstanding work we've already had going on that has been in place for some time, and also just supported through other funding. But it doesn't mean that it isn't something that will be addressed in the future. And then just really quickly, Katie, on prevention, I will just say that prevention's really tough, and I will say I'm a preventionist at heart, but going back to, well, I would just say that we had, I think a lot of people's goal is to get at more upstream prevention, and we had some efforts to do that in our plan that were unfortunately removed and not included in the final approved plan by the legislature. So the only prevention programming that we currently have in the plan is really looking at going to support school-based and after-school prevention efforts. It's something that clearly came across in our listening session as something people wanted, so we are responding to the people's requests and needs there. I'm sure as many of you know, again, I'm not an expert in this area, but from what I understand from my colleagues at our Department of Public Instruction, funding for substance use prevention within schools has been severely cut over the years, if not decades. So there's just not as much in that area. So at least we're looking at kind of trying to backfill some of that and making it more present in school districts across the state, though we still are not going to be able to get it in everyone. But that's kind of the limited work that unfortunately we're investing in prevention and up to this point, but we'll continue to try and do more in that space for sure.
Great, thank you. Well, on that note, I know we are about at time. I know that there are many more topics we could get into, but just want to thank our presenters for some really thoughtful and great information. And really thank everybody that participated in today's discussion. So also want to thank on our team, Rebecca Faulkner, Sam Merman, and Miriam Pearsall for making this webinar possible and their ongoing work to support the State Opioid Settlement Network. And just as a reminder, we will post this recording, and I saw some requests for slides as well, so we'll make sure those are posted. So again, thanks so much to everybody. We're going to be continuing to tackle some of these important issues. So have a great day.